Okay, we're going to go ahead and get started. So introduce myself. I'm Michael Becker. I am the current board chair of Old Pueblo Community Services, as well as the president of the Southern Arizona chapter of the American Institute of Architects. And I'm also a partner with Swaim Associates Architects. So I'll be moderating the discussion today. We're going to be talking about the COVID response in the city of Tucson in partnership with OPCS to use a local hotel to house persons experiencing homelessness. Before we get going, though, we had the mayor was going to come on and give some remarks. Unfortunately, she was pulled away and wasn't able to come, but we have Hennessy's from the mayor's office here to make some statements on her behalf. So take it away.
Hi, everyone. Thank you, Michael. My name is Hennessy Scubillas, and I'm the Community Engagement Advisor at Mayor Regina Romero's office. Again, she's very sorry she wasn't able to make it. We were really excited for this forum today. But in that, I'll just share a quick message from the mayor. So we cannot address homelessness without first acknowledging sort of the underlying issues that are going on right now within our community. And it's an important time for the city to ask itself if we're trying to manage or solve homelessness, because in the wave of this global pandemic, we see homelessness as it is, but then there will also be a second wave of homelessness with folks that can't afford their rent, who are out of jobs or are just unable to make ends meet. And it's really a time for the city of Tucson to think outside the box and looking at new frameworks and working with new partners in order to address homelessness as it is right now. So thank you so much for this opportunity, and I'll stay on. And again, the mayor, sorry she wasn't able to make it, so thank you.
Great. Thank you very much, Hennessy. And yeah, we're sorry she couldn't be here as well, but certainly I understand there's a lot of pressing issues in the city these days. I want to take just a brief moment to acknowledge our sponsors. Put up this screen. Oh, I think I'm sharing the wrong screen. There. So our sponsors are that we're doing this in partnership with several people with the City of Tucson, obviously, Pima County, Tucson Federal Credit Union, Bank of America, Rio Nuevo, AIA Southern Arizona, and Swaim Associates Architects. So certainly want to thank all of our sponsors. Briefly, I want to say a few things just about the history of the forum. We started this event about 3 years ago to really, at OPCS, we started the Housing First Forum about 3 years ago to start to raise the understanding and the profile of the Housing First model for solving homelessness in the community. The first year was really a tour and a discussion. The second year, it really broke down into a full day seminar where we had leadership discussions at the end of the day about how to begin to collaborate between different agencies to really start to implement and move the needle on homelessness. We were going to do something similar this year, but obviously with the pandemic, that's not going to be possible to have a large in-person seminar. So what we've decided to do is a series of webinars over the next few months to discuss housing first and homelessness through different lenses. So today it's going to be through the lens of the pandemic and the response. We'll have an event in September where we're going to talk about equity in homeless services. And then in October, which at OPCS, we're deciding that we're going to declare it Housing First Month. We're going to have Julia, I knew I'd forget her last name, Julia Durant from New Jersey. She's a housing coordinator there, where they've implemented a housing first model across their county and seen a significant drop in homelessness. We'll have a discussion with her sometime in October. So stay tuned for our notifications and join us for those webinars as well. So right now I'm going to turn it over to Tom Litwicki. He's our CEO at OPCS, just to do a brief sort of intro to what OPCS is and what Housing First is.
Thank you very much, Michael. Thank you to all the panelists and of course our sponsors. Thank you for being with us today, Hennessy's. I appreciate it. So OPCS is a nonprofit organization, a 501c3 that's been in operation in Tucson now for 25 years. Our mission is to end chronic homelessness within our community. We do that through a simple process of helping homeless persons acquire permanent housing, primarily through HUD vouchers and scattered site housing throughout the community. So people who are integrated and living within the community at large. Now, I said it's a simple process, but it's not an easy process. One of the first things I learned about homelessness and housing for people who were chronic homeless, about the first two things. One was that there actually is a solution to homelessness. It isn't something we, as Hennessy had mentioned, to move from managing homelessness to solving homelessness, which was a great awakening for me. And then the second one was that people could do well in permanent housing, and that was really the solution to homelessness. So the idea that housing is a solution to homelessness seems simple, but it hasn't been the traditional model for a long time. So specifically, how do we do this? We do our work through using the Housing First model. We adopted that about 4 or 5 years ago, and we basically went from providing services in the traditional model and then housing after services to providing housing and services at the same time, and assuming that people have a right to housing and everyone should have safe and affordable housing. What that did was that removed a lot of the barriers to housing and removed a lot of the barriers to services. And over the last 3 years, we've moved from an average of 500 people a year with OPCS moving into permanent housing to last year having 850 people move into permanent housing. So this model was developed in the late 90s, and it's been around for quite a while, but still not widely used and accepted. It's an evidence-based model, which means it's accepted with and demonstrated with efficacy from peer-reviewed journals and studies. And it is now the method that's assumed required to be used by HUD, the VA, and Health and Human Services, and any other major housing provider resource. So it becomes kind of the major housing, even though it might not be readily used. So we do realize one more thing, though, that sometimes I can forget, but this idea that we can't do this by ourselves. So we really need a motivated and engaged community that includes other housing providers, government, and the community at large to understand the solutions to homelessness and to give of their time and treasure in a way that supports these efforts. So the Housing First Forum is a great way, I think, for us to increase awareness and to maybe bring more people to this effort. So I thank you very much and look forward to hearing from the panel.
Great. Great. All right. Thanks, Tom. Yeah, I mean, this model that we've been working on OPCS for several years, and really, one thing that brought me to join the board at OPCS was really the sort of results-driven model that we have of really trying to show that we're moving people out of homelessness and into permanent housing and show positive results. And we certainly also appreciate the mayor's support of that. The mayor has been a supporter of Housing First for some time, and look forward to working further with the city to expand the programs. So to move to talk about today's topic, well, first of all, if you have questions, go ahead and put them in the Q&A box, not the chat box. We're going to go through the panel discussion. I'll watch the questions. If something comes up that I think we can address right away, I'll inject that. Otherwise, we'll address most of the questions at the end of the panel discussion. We also, I know we're scheduled to go till 11:30 or 12:30, but I've talked to the panelists. If we have a lot of questions or there's still a lot of interest, we can stay on for probably another 15 minutes. So we're going to try to be a little flexible and make sure everybody gets their questions answered. So to introduce our panelists today, we have from the Housing and Community Development Department, we have Liz Morales, who's the director of that department. We have Tom Litwicki, who I already introduced, the CEO at OPCS. We have Katie Skoblink, who is our Chief Operating Officer at OPCS, and we have Brandian Champion, who is the Supportive Housing Program Director at OPCS. And when it comes to talking about this particular program with the hotel, it's really been Katie and Brandy that have been on the ground in the hotel running that. So we're going to be asking them lots of questions about logistics and how all this is working. But I wanted to start off really talking to Liz about, how this program got started. What is it? What is the program, and how is it funded? Just get an understanding of, when the pandemic started. Obviously, there was a lot of concern about not only the shelter density, but the street homeless, who really are sort of most vulnerable population in this situation. So Liz, if you could just give a little background in terms of how this came about.
Thank you, Michael, and thank you everyone for joining on this important discussion. Thank you to OPCS for doing the Housing First Forum, which I think is an exceptional way of getting the message out. I can share a little bit about how it started. As we know, in March and April, we started watching what was rolling out as a result of the coronavirus pandemic. And some of the things that were coming out of the CDC was a concern around shelters, and the shelters came together and started meeting with various partners, the city, the nonprofits, and so they started asking questions. How are we going to address? They were trying to implement all the things related to sanitation and PPE, but in the end, the concern was they were having the same model with the congregate housing, and concern about people who were older with underlying conditions, all those things that put people at risk, along with people who actually were exhibiting some type of symptoms. And as we know, testing was not really available to too many people at that point in time. So as we were talking and the city was made aware, we were notified of some HUD CARES funding, CARES being the legislative act of some funding. We stepped forward and said, let's go with the CDC recommendations of isolating people who were high risk and isolating people who were symptomatic or actually COVID positive. And so once we decided that was the direction we were going in, we had to think about how did we want to do this. We saw that other communities were going with hotels, and we started reaching out to hotels to see who would have interest in working with this program. Amazingly, we had a pretty good amount of interested hotels, probably about 8 or 9. We ended up contracting with 2 hotels. One was geared to serve those with the high risk status, meaning they had no symptoms, but they were of that population that the CDC identified as highly vulnerable to if they were to contract the virus. And the second hotel was to serve those who were symptomatic or had actually been determined COVID positive. And so as we worked with those hotels and negotiated, we started thinking about meals and what other things were needed: laundry services, transportation, as they were identified. So the first phase is we worked strictly with the shelters, because that was our first priority, was to deconcentrate those shelters and get those who were high risk out of there. And so as we finished up that first round of the phase, then we went to those on the streets. So we worked with our outreach teams, Tucson Police Department. We set up a screening tool that was used, and also implemented a contract with El Rio to provide the medical screening and also ongoing health services. So a lot of different players. And OPCS took over the largest hotel for us that was for those who are high risk. We ended up contracting for a total of 355 rooms. And then the county took the role as the shelter hub, receiving all the referrals, the screening tools, putting that into the Housing Management Information System, which we call HMIS. And then the referrals would go out to the hotels based on that individual's screening tool results. So it's been We meet weekly to discuss issues and concerns, and we do find a lot of things along the way, but as a team, we've been able to address a lot of those different issues. Old Pueblo has also in addition to running the shelter, they also provide case management and have been really instrumental with housing placement too. We also contracted with Community Bridges to do the symptomatic and those were COVID positive. And as I said, we contracted with El Rio for the health services. Also Primavera and Catholic Community Services have been assisting us with additional case management to supplement what OPCS and CBI are able to do.
Okay, great, thanks. You started touching on my next question, which is about sort of roles and responsibilities. So currently, I'll have you kind of address what the city's role is right now, and then I'll have Katie talk about OPCS and kind of hotel staff.
Sure. The role of the city, I mentioned how we started, but ongoing, the city is also managing those contracts and then also looking at the end plan, right? The exit plan on how we're going to, at what point do we start looking at exiting? I will tell you right now, and I know that's one of your questions, we don't know the end goal, but as we work together, this is not a sole city decision, but it really is asking the providers what are they seeing and what are they doing. So our goal is to ensure that contract management, invoices and payments for all the contracts, and also on the risk management side, just ensuring that we're following the rules that we need to per the CDC and the Pima County Health Department.
Great. And Katie, could you just talk a little bit about OPCS, and then also, I know the hotel staff is actually still working in the hotels as well.
Sure. Good morning, everyone. So OPCS is the lead agency on this project. We are managing the operations of the hotel. So we welcome residents, we check them in, we inspect their property, assign rooms, we make IDs for them. We resolve any kind of room key issues they have. We monitor laundry and coordinate all the time with the hotel management. I think as Liz mentioned, we also provide on-site case management 7 days a week. The capacity at this hotel is for 200 households, a household being a single resident, a couple or a family. So OPCS provides case management for 100 households, and then Catholic Community Services and Primavera provide case management for 50 households each. All three agencies have offices at the hotel with multiple staff on site during regular business hours. So, as Liz was saying, obviously the goal is to permanently house all these residents. And to date, we have served 371 households, and we've permanently housed 91, which is great. So that's essentially OPCS's role on the project. For the hotel is running the front desk, maintenance, all the housekeeping, and providing all the meals. So all residents get 3 meals a day delivered to their doors. It's been wonderful between hotel staff and OPCS. We really have got to know each other really well, and we're working really well together. So it's really been a great team effort.
Great. So that it's the interesting part is the hotel is essentially still functioning as a hotel, providing services they would to any hotel resident or guest. We happen to have a different population that's currently occupying the hotel. The next couple of questions I'll ask Brandy to address. It's kind of as you bring people in, what's your kind of intake process? What sort of testing procedures do you have? I mean, basically, just how does this kind of work, in a practical way on the ground?
So we receive a referral from Sullivan Jackson, the county, as Liz touched on. The client's dropped off by one of the many transportation providers. We put their stuff in a hot box. We orientate them to basically the rules of the hotel, no smoking in your room, that type of thing. We then have them fill out an application, and we match with an agency, whether it's us, CCS, or Primavera. And they get scheduled for an intake at that point. We get them into their room, explain their meals to them, that type of thing. So some of the things that we're seeing is that it's surprising is this model, surprisingly enough, works. The people come in, they get a shower, their whole attitude and their demeanor change. So that's one of the great things about being so confined in this hotel is they get to see the result immediately. You know, there are a few issues. We have some issues around, you know, people not totally following rules. You know, we address those quickly. So for the most part, people are following the rules and things of that nature. As far as data tracking, we track the data through HMIS and through our own electronic health record. We have various spreadsheets, things like that we track the data on, and we do have a weekly call with the City of Tucson. So we're all in the know about what's going on with the hotels at any given time.
Great. And you know, in terms of what kinds of clients you're seeing, I know Liz touched on that a little bit, but maybe talk a little more about who are the people that are really being served by this program?
So these are that are super vulnerable. We do a lot of high mental health, of course, co-occurring disorders, people that are substance abusing. So they obviously have some issues, and we have staff on site that are equipped to deal with that. And if we're not, we call staff on site that are. We work with behavioral health providers. The medical team, El Rio, has been fantastic. So we have some issues, but we also have the people in place to address those issues. And we're seeing the people straight from Santa Rita Park, straight from the street corner. Those are the people we're seeing, and you'd be surprised at how this model, we see it right in front of us working with some of these folks where they come in, as I said, they shower, their whole demeanor changes. They're ready to go, and they're ready to start the housing process, and they're engaged, and they want to be inside. So it's a pretty amazing thing to witness.
And in one of our conversations, you had mentioned from the hotel staff's perspective, it's really not that different than normal operations for the hotel, other than they're at close to full occupancy. But other than that, they're not seeing anything out of the ordinary what they would see under normal hotel operation.
Absolutely not. As a matter of fact, one of the gals that supervises are the maid staff here, and she's been here for 20 years. I'm always saying, I'm so sorry. We didn't mean for that to happen, or, apologizing. And she goes, this is nothing. We see this with regular people that come in and rent. So it's interesting. Our clients are really no different than everyone else. They're just dealing with some issues, so.
Michael,
Yeah.
if I could add to that, I met with the owner last week, and he shared that some of his staff had apologized after seeing who they were serving, because initially they were pretty hesitant to serve this population. And one of his staff told him, I'm really sorry, I can see what we're doing. And I think this has brought, for this particular hotel, an awareness and a real sense of service that they've never felt before. The owner said because of this project, they've been able to retain jobs for 85 people. And so he said this project saved his hotel. And so, but it's really neat to see the engagement from the private sector on this and how much they're feeling a part of this overall project.
Yeah, that's great. And it really ties directly into kind of the philosophy behind Housing First, is that, if you treat people with dignity and respect, then, you know, that's the first step for them to really start to get back on their feet. And by, you know, bringing them into a hotel, I think if you told anyone you were going to fill a hotel with homeless people, they would all assume that the hotel would be on fire within the week, you know, burned to the ground. And obviously that's not what we're seeing. You know, we're seeing, you know, people get in and it's that kind of first step on their way to, you know, hopefully as we transition through this whole process, hopefully we get as many of these people as we can into permanent supportive housing. That's kind of our big goal. And I think that's why, you know, kind of the data tracking is going to be really important. Understand who's coming in. I think something that's really interesting to me about this program is it's a like rapid housing first experiment that we were forced to do because of the pandemic. You know, we've been talking about housing first and putting people into permanent housing for years, and it's not enough money. You know, we can't find enough funding. And then, but you know, you have an emergency like this come along, and all of a sudden there's plenty of money. You know, this is actually a very expensive way to house people, but it shows that, and what I'm hoping as we track the data, it shows is that using this model has long-term beneficial results. So even after the pandemic, we can see that the people that went through this program and see their success rates. So I think, you know, Brandy, you touched briefly on sort of tracking the data, and I know we're within OPCS, we're tracking our clients as well to kind of see what their success rates are as we move forward. Because we've already we've already transitioned several individuals and families into permanent housing. Is that correct?
Yes. So as Katie had touched on, we have housed, and we're actually tracking for everyone in the hotel on a separate spreadsheet because, of course, you know, everybody has their own HMIS data entry. So we are also tracking it in our electronic health record for the OPCS clients. So we've housed 91 folks today in various forms of HCV, which are housing choice vouchers, rapid housing programs, and self-resolving. Some people have self-resolved. They just needed a minute to sit down and figure things out. So it's surprising to me. One of the major issues that I see is that we're actually going to we're running into shortages on the one-bedroom apartments. And I know the city has been instrumental in changing some of their stuff in the background to meet our voucher needs. So if we have a mom and let's say a 5 or 6 year old kid, we're putting them in a 2-bedroom rather than a 1-bedroom, which helps us get them housed quicker. So that's kind of the only major issue that I see with this, is that we're running low on our housing inventory for the 1-bedrooms.
Okay, that's really sort of a community-wide housing bigger issue that's going on in the community.
Yeah.
I know we talked on the board and with Tom about, you know, that becoming an issue as housing affordability becomes more challenging. It'll be harder for us as an agency to find, you know, apartments to move our people into on a permanent basis. Liz, you may have touched on this just briefly in the intro, but I know, you know, obviously, you know, the pandemic will eventually end. CARES funding is eventually going to end. The hotels eventually going to want to go back to, you know, serve their normal clientele. Do you have any idea how long this might continue, or are we really just going on a week-to-week basis right now?
We're absolutely going on a week-to-week, month-by-month looking at this, because we know that until we see some serious decline in the numbers, that it's not safe to go back to how status quo. And that's why I think there is such an urgency for us to get people into housing. One of those things we did was look at what our public housing vacancy was like. And we were able to this date, put 36 into vacant units in our public housing. But, you know, as Brandy was talking about, the limitations with our greater community to be able to use rapid rehousing and our vouchers. We're also investing in putting out, bringing on additional navigators where we help people to talk to landlords and to help present people to get those units. So as much as we're bringing people into the hotels, as we identify them, we need to continually move them into placements that they'll be a good, safe, decent housing, but also looking how we can support them after they're housed.
Great. Yeah, I think that's the other part of this is, as this begins to wind down, what is that transition plan? How do we begin to break that down? And maybe from OPCS's perspective, what sort of conversations and thoughts have been going on within the agency about, what we start to do to reduce the hotel population as the program winds down and move these people permanently into housing?
I think as a whole, we've been, discussing it internally, how long it's taking us, especially with the shortage in housing inventory for the 1-bedrooms, how to move these folks along. And I think that's a bigger discussion on when to start winding down. At this point, it takes us about anywhere from 30 to 60 days to house folks successfully. Now that we see some of these rapid rehousing programs opening up, it may be a little easier, but as I said, with the housing inventory, it takes us a second to search for new housing for these folks. So
that 30 to 60 day time frame, are there any major drivers that create that it takes 60 days, or are there things that could be streamlined in the system?
For the most part, I think that the city overall has done with the vouchering, has done an excellent job. What I've found that has surprised me throughout this process is all the red tape that's been cut to allow us to get these people quickly into a housing opportunity. I think mostly at this point, we're dealing with a lot of document collection issues, not being able to verify people from out of state, things like that. So people kind of dragging their feet a little bit on finding a place. And so we have to kind of move them along, or we have to schedule a day to take them out in a group to look for housing, which takes staff to do that and transportation to do that. So those are some of the things that we're noticing come up now that people are starting to get vouchered or selected for rapid rehousing programs.
I would add it. We conducted a survey of all the people who are actively looking with vouchers. What were their barriers or their obstacles? And it really was, one, landlords don't have a lot of vacancies because of the eviction moratorium. Not a lot of people are leaving their units. Landlords typically have turnover of units that they can expect, or lease end dates for people. And what they're finding is people are staying in place, or they're not able to move people out because of the eviction moratorium. So that has also kind of created a bottleneck on what's the traditional kind of turnover that we see in the rental industry. We have people vouchers who have units selected, but they're not available till September, even some in October. So that is one of the big issues that we've heard from surveying our tenants or voucher holders.
Thanks. I have a few more questions, and then we'll open it and we'll answer some of the questions that are coming in on the Q&A panel. And this is really to everybody on the panel. I know, Brandy, I think you had mentioned that, for the hotel, this has really helped them, or maybe it was Katie that mentioned it, that you've had 85 people that were able to keep their jobs that would have probably otherwise been laid off. In thinking about, both sort of lessons learned and silver linings, is there anything that really jumps out to you about this? I know, Brandy, you had mentioned how it's amazing how fast we can really remove a lot of the red tape that normally is associated with trying to transition people into permanent housing. But maybe I'll just kind of go one by one and see what thoughts you have in terms of, I think, good things and bad things. Like what up that you didn't expect that was difficult to deal with, or what was something that was really sort of an amazing, aha moment for you. So I don't know if we want to start with Liz.
Yes. So one of the early on, as we're trying to identify what are the needs of people once we placed them in hotels, knowing we wanted to keep them as on site as much as possible. And one of the things was people who smoke. What do we do when they need to buy cigarettes and those type of things? And the county stepped up and really came forward with a cessation program to help. And we were surprised. We got a lot of people who wanted to participate in that program. And OPCS was really instrumental in connecting those pieces. So, you know, it's just trying to understand what are the needs. And then when you do, it never fails me when people are placed into permanent housing, when they know they have a place of their own, the overwhelming response and reaction they have to that, that never gets old. And so it's the constant understanding that there's not enough, but when we can help those that we can, it really is rewarding. And so that's been my takeaway.
Yeah, thank you. Katie, you want to jump in?
Sure. Kind of similar. This has been just an eye-opening, just really moving project. You know I've said to staff on several occasions, it's like running a hotel / a nursing home / a mental health ward. It's really quite the operation. And one of the things I would just say, it's been so moving. I know myself and my staff had experience, taking these residents to their rooms, their hotel rooms, and there's been occasions where they've just stood there in disbelief and started crying because they've never lived anywhere like this before. So every resident in this hotel gets their own suite. And it's just really moving. It's really moving to watch that and to be able to offer that to them. So that's really what I wanted to share, along with what's already been mentioned about the fact that, this allows all the hotel staff to remain employed, which is great as well. Thank you.
Yeah, thank you. Brandy, you have any other thoughts?
I want to just reiterate what Liz and Katie said, is that it's really rewarding when you see some of the reactions of these people when they first come here. They can't believe it, and they're quite respectful. There's quite a few people. We have people that, of course, that aren't, but then we have a bunch, which is surprising to me, that are very respectful, very loyal. They pass on the word, hey, let's follow the rules, let's do this, let's take advantage of this opportunity. And I think that's really rewarding to watch all of that, and to watch how happy people are when they get their keys to their apartment. Some of them are just overwhelmed with emotion, and it's really neat to see. So
yeah, that's wonderful. Tom, as the CEO, do you have your own sort of lessons learned or silver linings from this?
Well, I mean, I guess for me, it's always wonderful to see this process work, to see that if you believe in people, and if you provide the conditions for their best self to come out, that amazingly it does. And so much of this work, I've been doing this for many, many years in behavioral health and in housing for the last 10 years. So much of it is, from an administrator's point of view, is this kind of risk management, this worry. What if this happens? What if that happens? And, just recognizing and holding your breath a bit and taking a risk. One of the things that I've noticed in systems is that when I started working in homelessness is that there isn't a whole lot of risk for systems to have someone on the streets. But when you start intervening, that creates some risk, that creates some trust. And if you're not willing to take that risk, it's hard to actually have success. And so, it's just wonderful to see that come out and to happen. And, for me, I'm amazed at how, with this sense of urgency, how people can come together like this and with that shared goal really move things quicker. And it's, that emergency is kind of the mother of invention, right? It's, It's, you know, this normally takes 90 days, but somehow we're going to do it in 30, and we don't know how, but we have to. And for me, that's fantastic. And I didn't always expect that in bureaucracies. And so keeping that, I think, is going to be critical. How do we keep that sense of urgency and keep that in mind, that this is really an urgent situation, even after the pandemic's over? It's always been an urgent situation.
And the pandemic just sort of highlighted the urgency when there's a public health risk that's involved. And I'd agree, just the way the model on OPCS, it's again people with empathy and dignity and compassion and that community that is really is why I'm involved with OPCS and why this is so important and why it seems like it's the right path forward for us to really solve homelessness in Tucson. I have one last question for Tom, and then we'll take some of the audience questions. You just mentioned that we had this sudden, the community had a sudden sense of urgency about homelessness because of the pandemic. But in seeing how this has played out, and as the pandemic wanes and we kind of start to get back to normal life, what do you think this is going to mean long term for housing first in our community, and how do we carry this one-time opportunity forward until, like you said, like maintain that sense of urgency that just because the pandemic's gone, homelessness is still, a real issue for our community.
Thanks. Yeah, I think this sense of urgency is critical, and that's, as I already mentioned, and how can we as community partners and the community at large and government and the private sector really get engaged in this. And I think to create that sense of urgency, I think one of the things that does that we can promote is just this idea that this is a solvable problem. And saying that is a risk. And still, most people in this industry and in the community, when I say we can solve something like chronic homelessness, still kind of go, okay. And to really, be able to take that risk and to really step out there and do that. And then I think the other part of it is that, the pandemic of this level has changed the work we do. And there's always models of business that work better in one environment or another. And the reliance on kind of this large shelter model, which can be kind of an efficiency sort of model for communities, it's, how do we go back to that, and what does that look like? And can we go back to that, and should we? And we still need shelter. We still need, ways for people to get off the streets. We still need that compassionate intervention. But what does that look like in the future? Because it's not going to be 100 people in a warehouse. How does that work? How do we, a lot of the work in fact, all the work we do is this kind of low barrier bridge model where you are using apartments and things like that. And how do we find ways, some communities have had to turn shelters into more like that type of housing. If you take too many apartments, then you're taking away from the housing inventory, which is not what we want to do. But how do we create shelter in a way that you have this safety, but then also you're creating stability? I mean, one of the challenges of the traditional shelter is there isn't much stability on where you're headed. You can't stay there as long as you want. So, I think in the end, we'll have to really transform our model. And OPCS, we've had, as you know, a number of committees and meetings talking about how do we get more housing? How does an organization like OPCS start transitioning into more permanent housing and maintaining an inventory of affordable housing versus, these kind of leasing ups and downs, because somehow we're going to have that affordable housing available. And how does an organization, frankly, like OPCS, start moving into some intervention in that bridge housing that isn't taking up housing inventory? Because, of course, the downside of the work we do is that if we do too much of it, we start taking up housing inventory because we're using apartments. So it's a lot of change. I think the big silver lining for us is that we have literally seen how the city the county, nonprofit entities, private sector can work together, and it can be win for everyone. And you know, that's the truth. And I think keeping that alive and really talking, you know, someone like Liz has been able to work with the county and on another project we have, and cut the time it takes someone to go through the housing process in half. And I think we just need to know that we can do that. Just because we've had traditions doesn't mean that we have to stick with those traditions. We have to look at them and really say, is this getting us where we need to go? So it's exciting to me. There's a lot of stuff, but I think the big thing is going to be this real change in how we do this work. We're forced into really getting a different paradigm, is my opinion.
Yeah, absolutely. And I think, you know, I know you and I have talked several times that really, if we're going to solve homelessness in our community, it's going to take that collaboration with the entire community. So, you know, government can't solve this. Nonprofits can't solve this by themselves. You know, we need, you know, government working with nonprofit, working with private, local companies, working with, you know, individual citizens to really come together behind a solution to be able to really move the needle and so that we can end homelessness. Because I know, you know, you say it all the time, you know, it's to say that this is a solvable problem. A lot of people don't believe us because it's been going on for so long, but you know, the resources are there. It's just a matter of focusing them in a way that's going to continue to provide results moving forward. So,
and I think, you know, I would say it's great to have Liz, the county, the mayor, so committed to this, because that's really what it'll take. I had a great conversation, as you remember, from our second Housing First Forum, where Chief Magnus basically stood up and said, you know, what he was hearing was a lot of nonprofits and a lot of government agencies saying, well, we're not really ready. We don't have this or we don't have that. And when we get those things, then maybe we can make some progress. And he basically said, you know, we need to shift this to where it must be done. It just has to. And that's the urgency that the pandemic brings, because the police department doesn't have a choice. They can't say, well, we're not ready to deal with this problem, and until we get resources, we'll just not show up. They have to do it. And I think we have to take that approach that it must happen. If we need outreach people in the middle of the night, then that's what must happen. It doesn't matter what, you know, somehow we need to take that kind of emergency kind of approach to it, to where there isn't this, well, maybe next year we can get some money to do that. It has to happen.
Absolutely. All right. Well, that's the end of my questions. We do have a few questions that have been posted by the audience, so I'll walk through some of those. The first one, I'll read it, and if anybody on the panel has a sense of where this is going, let me know. Otherwise, I'll ask the person who submitted it, maybe you can give us a little more background. They were simply asking, are you familiar with what is going on in Portland? So I don't know if that's enough information for us to be able to answer that question.
There's a lot going on in Portland.
There's a lot going on in Portland. Yeah, my daughter lives in Portland. So yeah, Paul, if you could maybe just give a little more context to that question, we'll try to address it in a few minutes.
And the one thing I would add is, we know, what I know about Portland is their housing costs have gone up exponentially, which has really impacted and increased the amount of homelessness. I will say a lot of communities are doing a lot of different things around homelessness, and they all involve housing first. So, you know, we are always looking for good models. So if anyone wants to share a model, we're more than happy to look at how we can look at that on a community level, again, not a city or county project, but really a community level as to how we might want to do that.
Thanks. The next question from Patricia, maybe Tom, you can start this one. It says, has the CARES funding been sufficient to cover the cost of the program?
Yes, it has been. There's always a little bit of expense, you know, maybe, you know, anywhere from 2 to 4% that isn't covered by whatever funding, federal or state funding. But for what we're doing right now, it certainly has been enough to cover what we're doing. Now, would it help if we had, would we fill another hotel if the capacity was there, if the funding was there? Probably so. I think one of the things we're running into right now, which is the first time I've ever experienced this in my career, is that there's funding for things that agencies, I think, don't have the capacity to handle. How do you bring on staff that quickly? So sometimes it's not even the funding, it's the organizational setup and the structure. And with that, I know, and Patricia, I think there's also this issue of who covers the administration costs, because a lot of times federal monies and things like that don't cover a lot of that or have real restrictions on it. So that makes it even harder to try and scale up to start new projects and new things quickly when you don't have those costs. So they are it is covering it, but there's always could be more.
Yeah, Liz, do you have anything else?
Yeah, I would say that, when we saw the price tag, I will say that did take my breath away when I realized how much this was going to cost. Fortunately, the city received coronavirus relief funds and also some FEMA funds, and the city manager's office has been really helping us navigate that so we could utilize those funds first before we haven't even touched our HUD CARES funds. So we do have some set aside should we need to do that, but we're utilizing the more less restrictive and what's meant to be used for this type of effort. And so right now we have enough funds. We keep getting extensions through FEMA to do that, but there could be a point where the funds do stop and we touch what the city council, mayor and council did with the strategic plan. There's some funds set aside there. When we tap that out, we'll go to the HUD funds. And when we're there, we're going to have to wind down. But the funds are there for now, fortunately, through the CARES Act.
Great, thank you. This is from Charles, and I guess I'll direct this to Tom because I know we have an ongoing program with Pima County. But Charles is asking, do you connect with Pima County Jail on people being released to homelessness?
We do as an organization, and Pima County has a Pima County Housing First pilot program, which is in its second year, and will move 150 people into permanent housing. And it's folks who have been in and out of the jail a lot and have been in and out of the hospital a lot. So they have a lot of concerns and a lot of health concerns, and so it's expensive to our systems. And this kind of model of trying to reduce the cost curve at the same time that you're doing something that's very, very helpful to those who are in need, and that's will turn out well because it's already been proven in so many other jurisdictions. If we just simply do and stick to the principles of it, that will work just fine for people coming out of jail. I think the challenge for jail is, they have more people than we have housing or programs. And so people can get stuck in jail, and that's not good. That's a challenge. And then we have housing, and we're probably one of the few, actual agencies that still does housing for prison and jail reentry. There really isn't funding for that. The Pima County Housing First one was very unique that there was actually funding. So now I don't know, and I don't think that we take referrals for the hotels directly from incarceration. But I can't answer that for sure, but Katie says no.
Okay.
Early on we did work with the jails through our weekly shelter call. It turned out they were able to place them into some other locations, and they've not had any COVID positive release that we had to help, but there was a lot of conversations working with the county jail.
Great, thank you. This is from Kenneth. Says, I'm curious whether you at OPCS have seen an increase in demand for homeless services already, and whether there's a planned expectation for a potential surge in the fall. I'm assuming he's talking about when the eviction moratorium ends.
We are getting a lot of phone calls. Historically, we've worked with folks who are homeless, and we do a little bit of, eviction prevention, but that hasn't been the primary area we've been working. So we're not like on the top of the list. So I imagine those who are on the top of the list that do this are getting a lot of calls, but we are starting to get a good amount of calls. And I know Liz is certainly, in the city and county are preparing for that. For us, it's about having to bring on more of a workforce to be able to address that. The hotel we've been able to do with a lot of the same workforce, but the eviction is going to be significant.
Next question from Christian, and this may be mostly for Tom, but maybe Liz might have some comments. What has been the pushback from accepting the Housing First model from other municipalities? Or has there been, I guess?
You know, I don't think there's a direct pushback from municipalities. I think one of the challenges for municipalities are, you know, they're usually, not always, but usually in the role of funding services. And so changing the funding models and shifting the current systems. So, I mean, if you're going to shift money from services and into permanent housing, that means for an agency, if maybe they don't get Medicaid funds, they don't know how to now get any money for their services. So how do they stay in business? Because they've been using housing dollars to pay for the case management and that. So I think it's the time it takes for the agencies to transition and for the government to do it. And there's I imagine some political will in there too, because there's a strong donor base for a lot of non-housing first models. And so I think the cities or municipalities may get pushback from donors when the big donors, when they change their kind of approach. But as far as talking to folks who are, you know, in municipalities, they typically get the model and are supportive. I don't know if you have something to add to that, Liz, but.
Well, you know, I come from a couple different perspectives in the sense of, let's talk about public housing authorities. I think that has been a pushback to participate with serving those who are coming directly from the streets. I will tell you that there has been a paradigm shift in some jurisdictions in Arizona. Some still have some we need to bring them along. But I will say that, you know, City of Tucson has already been doing that effort with working with our providers like OPCS, who provide those referrals. We have a homeless preference and we get them into housing, and the OPCS will provide those supportive services. But it is, even though Housing First, if you look, Tom had mentioned to me that Samson Barris came last year through OPCS. I met him over 20 years, I think about 20 years ago I met him, and I was learning about Housing First. And I will tell you, there's a lot of communities who've taken it on and many who don't want to really acknowledge the issue that and understanding that there is a solution. So we've made, I say, since I've been working in homelessness, a lot of progress. But that doesn't mean we are at the point of ending homelessness in all communities.
Sure. Thanks.
If I could just touch on one thing.
Yes.
Well, I just wanted to add to what Liz and Tom said, in that I think that people are a little bit resistant to the Housing First model just because of the issues that come with it. It's Housing First, but it's not housing only. So having those wraparound services, it takes you know, a certain caliber of case manager to really deal with the day-to-day issues long term for some of these folks. And that is part of the training that we get at Old Pueblo, is the motivational interviewing, the crisis interventions, dealing with the landlords and things like that. So I think that that's why sometimes people can be a little resistant to it, is because we're putting people in housing first and then dealing with all the other issues like substances, mental health, medical, and that takes work. So I just wanted to add that.
Thank you. The next question is from Susan. She says, how can individuals best support this amazing program you're describing? I'm not sure they can support the hotel program directly, and I'll let Tom or Liz answer that in a second, but you can support OPCS directly. I was going to plug this at the end, but OPCS does qualify for the state tax rebate. So as an individual, you can donate $400, and as a couple, $800 to OPCS, and that's a direct state income tax deduction, or it's actually a refund. So it's a dollar for dollar, you get your money back. So it costs you nothing. And for $800, we can provide a tremendous amount of services. But in terms of this specific program, is there anything individuals can do?
We get a lot of support through, you know, people, through Monica's teams out there making masks for people and making bedspreads and sewing and things like that people make, so that when someone moves into their apartment, it feels more like a home, or their child may have a new bedspread, or I've seen backpacks coming in now. So those things can be very helpful for someone. Sometimes it's the little things, you know, like trauma programs that, you know, can provide a teddy bear to someone, you know, a kid when they're having to move into some place new like that. So all those kinds of things are helpful. And then just the awareness to really, you know, be out there talking with, when you're talking with other people about who they support and what they're trying to do, to be able to educate them that there's this model. And it's not hard to find out about. You just type housing first, you hit Google, and you'll find all kinds of really solid articles about it that you can educate other people. And then of course you can always give to it. We're in the very initial stages of developing a center, which we will be calling the Center for Housing First. And that will be unique in the sense that we're not trying to run a shelter. We're trying to run all of the supportive services and all of the navigators and that out of one central location to go out into our community and solve problems and get people into housing. And so, you know, and sometimes it's, I got to tell you, when it comes to giving to those things, sometimes it's not as exciting. It's not as, oh, gee, I gave a meal. That can feel more tangible. But a lot of times, you know, if we put our resources together and get someone an apartment, they can cook their own meal. But because that apartment's out in the community, I can't tell you exactly where it is. It's not as exciting sometimes, or not as, there isn't that emotional connection. So if people kind of work through that and take that kind of evidence-based approach, I think that's helpful in their giving and support. But you can always give.
Yeah, I would say definitely the people on the front lines are service providers like OPCS. So supporting them and providing those type of things is the best way to support this program.
Okay, thank you. Daniel asks, I've helped SVDP on some of their work here in the Valley for the dining shelter spaces. What about the idea of using dilapidated housing hotels that can be purchased and rented for a low rate and renovated to be up to current standards?
You know, I would say that we definitely are looking at how to use some CARES funds. We do have one property that's a dilapidated housing that we have set aside some of the CARES funds so we can get that apartment complex renovated and used for this purpose for those who've been affected by COVID and are homeless. So, but that takes time. A lot of these efforts aren't instant measures that we can do, but they are investments. You know, one of the things the mayor has really been promoting is how do we develop more affordable housing? And I call it also permanent supportive housing, not just for those who just are at a lower income level, but those who really need the housing that it's very difficult to place them in the community. So if we can develop and bring on more permanent supportive housing that uses the housing first model is much needed in Tucson. And so that is some of the things that we're looking at and working on.
Thanks.
Yeah, I would agree. You know, one of the first things that I was involved in this position was a commission that was formed years ago to look at, you know, what priorities, what's the most important. And the one thing I got from one morning of it was a bunch of agencies competing. And it's very easy to get in this kind of, well, I want to build our thing. But in reality, you're going to need it all. There's no sense in, it doesn't do you any good to get people in housing rapidly if they can't maintain housing and end up getting evicted. You're going to need it all. Families are important. Households, the individuals are important. That, you know, you're going to need to fund a whole system. Otherwise, if we try and, like fix one piece of it and not the other, it doesn't work. And it's so easy to get competitive out there, but really it's all needed. And that permanent housing is going to be the final straw. What we do a lot is out in this emergency situation, but that affordable housing inventory that Liz is talking about is what's going to really keep people in housing and prevent more evictions. So we get off this cycle. You know, Liz talked about the price tag of this. I think that maybe part of us to look at is that if we can stay with this momentum after the pandemic, maybe we can avoid that price tag again. Because if we, you know, it's always woulda, coulda, but if we put more energy into street homelessness and getting people housing first and into housing over the last 10 years, we wouldn't have had to spend quite as much money today. And that's just, I think, the truth.
All right. Our next question is really a comment from Kayla. She says, thank you all for what you've done and continue to do to help so many. You're certainly changing lives in the world. So thank you, Kayla. Appreciate that. So Paul has provided a little more background on his question about Oregon. He's talking about there's a document called the Community Strategies to Address Homelessness in Portland, Oregon. And this is tied to the ideas of creating tiny houses built by contractors with in-kind work on property that are unused in easements and right-of-ways, and then shared kitchens that are potentially containers. I'll address this a little bit, and maybe Tom, if you want to jump in. You know, when I first got involved with homelessness was when we had the Dream Pods in downtown Tucson. There was a kind of homeless protest going on. And, you know, I reached out to the city to get involved, thinking along these lines that we could create little communities, you know, tiny houses. I quickly realized a couple of reasons why, at least in Tucson, that's not the best fit for an answer. Maybe in Portland, because of the real estate costs and housing costs, that they may need to be looking at options like this. But at least in Southern Arizona, when you look at the cost of, even if it's in-kind donations, you know, you look at the amount of resources that go into creating these tiny house communities, you know, those resources can be stretched out a lot further if we're actually using it to move people into existing housing stock rather than creating new housing models. It's also what concerns me about anytime you start talking about creating a place for people to be, and it's something that the hotel is doing inadvertently, but we have no choice, is it segregates the home. You treat the homeless differently. Like they have homeless housing, or, you know, but, you know, they don't have homeless doctors. We don't have dentists. So I think the idea of, you know, what Housing First does is it moves people out of homelessness and puts them back into the community in a more dispersed and I think equitable and integrated way. So I think in some communities, I think these solutions might be necessary just because of the market conditions. But for Southern Arizona and for what we're doing as an agency, it's not something that we've really pursued. So Tom, I don't know if you have anything else to add to that.
Yeah, it's a really interesting model. I think partly because, you know, at least I fantasize about, gee, I could live in a tiny home and get rid of all my stuff. Don't know if I truly enjoy it, but, you know, it sounds exciting when I watch the documentary, and obviously a lot of people like that. Michael, you said exactly what I would say. I think the principles that go through other housing is the same here, and that is, you know, very cautious of any model that doesn't integrate people within the community wherever they want to live. So if it has this kind of a segregation model, even if segregating people is, you know, designed to be good and for their benefit, we have a lot of history of creating housing that then didn't get maintained, and we've concentrated poverty and we've concentrated problems into areas. So the idea of having a system in which people can live in different areas. Now, on the other hand, if the community inventory of housing wants to include tiny housing, wants to include different types of communities, for anybody who wants to do that, I mean, it's housing that's rented like any other housing, but it's much more affordable. Primavera has a project that's been happening where people have like a room in a apartment or whatnot, hotel, and then they have a bathroom down the hall. You know, 100 years ago that was not an uncommon thing, but today that's pretty uncommon. but it brings the cost down to something to where you can pay that if you're on disability and still have money and still have that independence. But the segregation part is what gets me. I think these ideas are better just adding to our housing inventory in general so that there's more affordable housing for whoever wants it.
Mm-hmm. Yeah, adding that as a housing option for anyone, then it becomes an option, obviously, for permanent supportive housing.
Otherwise, it's only a matter of time when you create the village, somebody does something inappropriately, something happens, and then before you know it, you need a security force, and then before you know it, you need a fence, and then it's sooner or later, and who decides who can move in and who can't, and it just becomes a challenge.
Mm-hmm. Okay. This one's from Zoe. I was touched on how the hotel staff's perspective and ideas of those experiencing homelessness has changed due to their new experiences of working with those in our community experiencing homelessness. Is there a way to expand this change in perspective across our community? How do we change our culture to bring respect and dignity back to those experiencing homelessness? That's a big question.
You know, one of my thoughts is that's going to be difficult to do as long as we continue to see the numbers of the people who are living on the streets, because it's very easy just to see the outside and not see the people for who they are. You know, for me, you know, changing the community, we have, I think here in Tucson, I've been really amazed to hear the feedback from people who are, you know, we don't want to, you know, a sense of empathy from a lot of residents that I have not necessarily seen in other communities. So I think Tucson has some of that. Of course, we have probably another segment of our community that is not very tolerant of seeing people who are living on the streets. But again, my goal is not everyone's going to be on board with this. Those of us that are doing this work and we need just to continue doing the work so that way we don't have the people living on streets, so that they don't have the stigma and have to deal with the difficulties of that shame and embarrassment that so many experience. So let's just end their homelessness, and then we don't have to worry about how people feel about them. Does that make sense?
I agree with that, and I also think that doing things like hiring peers in your agency that have experienced it and bringing them up. Old Pueblo is very good at doing that. They've hired people that have actually experienced these things and have risen through the agency to higher levels, and getting out and educating people about what Housing First is about and how the model works and what it is. Some of those things also work, I think.
Yeah, I'd agree. One of our biggest challenges over the years has been to really put together a really strong volunteer program, and some agencies have done better at that. But to create, we even have a program in which peers who are currently street homeless are paid to be guides to help introduce us to other people that they think are vulnerable. So create purpose and meaning and something for people to do, so they're not just a passive recipient of something. They're invested and involved, I think is very valuable. But usually stigma goes away with interaction. And I get where it's hard when you don't think there's a solution to see people in those conditions. And after a while, we start turning off our compassion and we just tune out. Which is dangerous, because if we tune out from that, it'd be nice if we could just tune out from that, but we start tuning out for other things too. And we start losing our compassion overall. And so I think Tucson is a very compassionate city. I think we need to create options and opportunities for people to be involved, including people who are experiencing homelessness. Because, usually when you break bread with people, when you interact with them, you see them as a person, and you start to lose some of that fear and some of that stigma.
Thanks. So if everybody's okay, we'll do 2 more questions and then we'll wrap up. Is that okay? Everybody's okay for time? Susan's asking, how are you handling individuals with addiction issues who are moving into the hotel housing?
So we obviously, as you would expect, we see a lot of addiction issues. Many who are coming in have addiction and mental health issues. We are just really trying to work with them. If there is using at the hotel, it's not a necessary straight away discharge at all. We try to work with them. But it is a case-by-case basis, so it's kind of depending on what we see. You know, if it's numerous times that the clients are using, we are going to look at, can we get them into detox? Can we get them into a treatment program? We can also provide counselling as well. So we can provide OPCS staff, some counsellors who are not working at the hotel, but we can bring them in to help provide counselling to the residents to help them with their addiction issues. We also at the hotel have MAT services, so medically assisted treatment. We have someone who comes weekly to provide those services as well. So yeah, it's kind of case by case. We're working with individuals as much as we can. Certainly wouldn't discharge anyone homeless.
Yeah, I think it's part of the housing first model. You know, if someone comes back to their room and they're high, we're not going to discharge them. We're going to just start again the next day and find out what we can do to help support them. Obviously, we don't allow use on premises as much as we can control that. And Brandy, did you have anything else to add to that, or?
Well, I just want to say that in line with the housing first model, we also just say at the front end, be respectful about your drug use, because not everybody's at a place where they're ready to stop, right? You know, don't leave your stuff out in the open. Don't share your things with other tenants, things of that nature. So, I mean, as much as people don't want to hear that, it's a reality that, you know, be respectful about your drug use. Don't let it joy the peaceful enjoyment of others. Bottom line. So.
Yeah. Okay. And then the last question, this may have just been a misunderstanding from Keith. He's talking about the question about purchasing housing with CARES funds. Who owns the property in that scenario? Liz, you weren't suggesting we're using CARES funds to purchase housing, were you? Isn't this more of a city, housing community development acquisition?
Through the what we call community development block grant funds, we are using it to renovate one of the properties we already own. So we don't have anything slated to purchase any properties at this time, but anytime that we use federal funds, they are the ownership of the city.
And then it becomes part of the city's public housing stock that then we make available through through the city's programs and also through other agencies' programs. Is that correct?
That is correct.
Okay, great. Well, with that, we'll go ahead and wrap up. Again, I appreciate all the participants, everybody that came today. We peaked out, I think, around 70 people, so we had a really great turnout. Thanks to all the panelists. You know, this was a really, I think this went really well, really great conversation. Maybe, you know, just open it up one last time. If any of the panelists, I'll just call it one by one if there's any last thoughts you'd like to leave the audience with today. So we'll start with Liz again.
You know, I'd actually like to add to what Tom was saying about the real magic that happened between so many different stakeholders in this. And I do think this does present some great opportunities to learn from this and continue to do this model of nonprofits, city, county, and the private sector. I do think that you know, what we've done has been to address a public health issue, but I've always said lack of housing is a public health issue as well. So just because the pandemic may at some point, you know, God willing, find a vaccine or, you know, get resolved, we still have a public health issue as long as people are homeless. So I do appreciate this opportunity to continue the conversations. There's a lot of models out there, but we have to make one that works for Tucson, and we have the right people to do that.
Thank you. Brandy? No?
I don't have anything to add. I think this went really well.
Great. Katie?
No, I mean, I appreciate the opportunity to share what we're doing here. It's really important work, and I think it's great that we've had this webinar, you know, to inform the community further. And I think just to add to this, I just want to give a kind of shout out to all the staff as well. Haven't really spoken about all the staff, all my staff who are on this project. This is difficult work. It's very rewarding, but it's challenging and it's draining. And, you know, I haven't been in the trenches for a while doing this, but I have been in this project in this hotel, and it's kind of a non-stop operation, and, you know, you're seeing crisis all the time. And so I just kind of wanted to mention the staff as well, that I appreciate everything that they do.
Okay.
Thank
Thanks,
you.
Katie. And Tom, we do need to wrap up before 1 because we have another webinar after this. So you would briefly have a couple of comments.
Oh, you act like I talk a lot or something. So big thank you to the staff. It's fantastic work, but it's extremely hard work. Thanks to all of the supporters that have stuck with this. You know, this is noble work. Someone told me that recently, and I believe it. It's noble work. In addition to the fact that it's noble work, 91 people go into the housing. We don't know which ones, but some of those people were going to die on the streets. So they're saving lives. Unlike a hospital, we don't always know which life we saved, but this is life-saving work. And so no matter what the cost, saving lives is important work. So thank you, everyone. That was short, huh? That wasn't bad.
Good job. So again, thanks everybody for coming today. Thanks Hennessy, and thank the mayor for us. I'll leave one last plug before we go. If you go to helptucson.org, that's our website, you can see the donate button, and that's where you can make your state tax rebate donation of $400 as an individual or $800 as a couple. That money can go a long way to helping us serve this population that we've been talking about all day. So with that, thanks again, everyone who came. Really appreciate your time, and you know, watch out for our when we send out the notification for our September event. So with that, everybody have a great afternoon.
Bye-bye. Thank you.
Thank you.